And basically, if you've never participated in research, I think it's important for you to know a few things. One is that the research is free of cost because it's funded by the National Institute of Health. Um, because it's a research study, we do ask you to uh, fill out questionnaires that will help us be informed about your specific symptoms in greater detail. So you're providing a service actually to the science of the study of hypochondria, and in addition, hopefully getting better as a result of the treatment. Now, one thing you should know about the treatment is that there are 4 treatment arms, so which means you'll get randomly assigned to one of 4 treatments. So you might get, for example, cognitive behavioral therapy alone, or you'll get the drug therapy with supportive assistance during the study, sort of supportive therapy, or you'll get a placebo, which is a fake pill, it doesn't have any active medicine in it, with supportive therapy, or you'll get, as Dr. Barsky was saying, a combination of the two, cognitive behavioral therapy plus the active medication. And in this study, we're actually using a medicine called fluoxetine, which is also known as Prozac. Um, so you need to know that you'll get randomly assigned to one of those 4 treatments. That you should also know that actually people who get placebo therapy, at least in my previous studies, a good number of them actually respond. So 30 to 40% of patients may actually benefit from the supportive element of visiting the psychiatrist and, on a regular basis, uh, as well as from just having been properly evaluated properly. So I actually think a lot of the patients in our study will benefit. Uh, and at the end of the patient's participation in the study, we break the blind and tell them what they were on. And if they want to receive something that they didn't get assigned to, then both in Boston as well as in New York, we offer them the option. So if you got a pill and you really wanted the cognitive behavioral therapy, we'll give you the cognitive behavioral therapy. If you got the cognitive behavioral therapy but not the pill, we'll give you the pill. So our goal is to help patients, but it is in the context of a research study, and there are certain parameters that we have to go by. Dr. Kelli Harding is one of the psychiatrists here who's been treating patients in this study. I don't know if you have anything to add. Uh,
Well, I would also just add that because our goal is to try to make sure that everybody who enrolls continues to get better, is that we also have independent clinicians examine patients at several intervals throughout the study to make sure that their symptoms are continuing to improve. And if they're not, then at that point we pull them out and offer them free treatment for 3 months, um, just to ensure that we're
what's the
continuing
age
to
range?
improve.
It's 18 to
It's
75, is
it's
that
18
right?
to 75, so a broad age range. Other questions that come up sometimes are what's involved in the in the screening. It's usually a history, a physical. We do some laboratory tests, which do not include an HIV test. We get asked about that a fair bit. We may need to consult with your doctor or if another physician you've seen to ensure that this is the right study for you. Those are some of the things, but we want to.
And in terms of the time demand, it's
Yes.
not too bad actually. Initially, it does take a while because we have to get to know you, so the evaluation process may take a couple of hours for the first visit. But once you get randomly assigned to your treatment, the cognitive behavioral therapy, Arthur, I think it's 6 treatments at first. So you come weekly for 6 weeks, and then you get another visit. I think at 8 weeks. Is that
Yeah, I think
right?
it's every other week for a couple of sessions and then once a month.
And then just once a month. So altogether, maybe there's maybe 9 or 10 visits, something like that. And then we do a follow up at week 36 and week 48 to see if people have maintained the improvement they were on. But in terms of demand, it's not that demanding, although we do want people to participate fully in the study. Um, I think it's a great opportunity if you have hypochondriasis or if you know someone who suffers from hypochondriasis to tell them about the study, to have them uh, take a look at our website, learn about it, and then call us and then just ask us for information. We're very open to talking to people. We spend a lot of time educating people about how to get help.
And I think it's reassuring for people that have participated too that they're not alone in this, because I think a lot of times it can feel very isolating for people when they're worried so much about a symptom and don't have any outlet for that and haven't found a real connection, I guess, with some of their physicians about this. So
Yeah. One question that people sometimes ask me is, why in the world would I want to take a medicine for something that, you know, something that's psychological, and that I worry too much about illness? And my answer to that is that every th- every thought we have, every experience we have in life is processed through our brain. And some people, for whatever reason, have a portion of their brain that is not functioning properly. At least that's the way I see it. And so I actually believe that hypochondriacs do have something wrong with them, and that it's not that they have cancer or AIDS, but that there's an obsessional over concern that they just have a hell of a hard time eliminating. And that through the use of a medicine that helps reduce obsessions, they can get dramatically better. And we know from work with other obsessive compulsive problems like OCD, for example, that not only medicine, but the appropriate psychotherapy can have a dramatic effect, not only in changing the symptoms, but also changing the brain blood flow and metabolism. So the appropriate psychological therapy can fix the abnormally functioning brain, and um, medicine can do the same.
well said. Okay, we'll go ahead and conclude, but I do want to remind our viewers that there are other segments if you want to learn more about hypochondriasis, its diagnosis, and its treatment. Thank you.